thank you for inviting me to this important event, and I'm so privileged and honored to be in this August gathering. And I can see some new faces that I know, especially Dr. Vinod Paul. I saw him after a long time. I'm so excited. So my focus today is actually science policy interfacing to improve nutritional status of women and children in South Asia. Although I'm from Bangladesh, I'm focusing in South Asia. So now that we are in 2021, so 2030 is not very far from now. In achieving this ambitious sustainable development goal in this period of 9 years seems to be a far cry from what we have been observing in our South Asian regions. And but we know this in this period, the world is still grappling with the triple burden of malnutrition, undernutrition, overnutrition, and micronutrient deficiency. Despite all those improvement in many countries of South Asia, the picture of malnutrition is gloomy. And even in my own country, we have seen that there's a huge improvement. But according to WHO definition, we are actually living in an emergency situation. So globally, South Asia holds the major portion of undernourished children and women because our number is huge. Nearly 2 out of 5 stunted under 5 children in the world live in South Asia. And the highest prevalence of wasting is also noted in this region. And also nearly half of the women of reproductive age suffer from anemia. And we know that obesity is also increasing in this particular population. I don't want to go because we have heard from many speakers about the status of nutrition. Let me go to what is actually in terms of the climate change and the food system. And especially in South Asia, agri-food system is the backbone. It's not only provides our food and nourishment, but also the primary source of livelihood of millions of people in the region. South Asian farmers feeds over 20% of the global populations, with only 5% of the world's agricultural land. Across the world, we are witnessing today not only the disastrous situation of COVID-19 pandemic, but also the effect of climate change. The disturbance of planetary health caused by human-made disasters results in emerging and re-emerging of diseases. And COVID-19 is one recent example of one health that emerged due to interference of ecology affecting plant, animal, and human health. In COVID-19 pandemic, farmers are exposed to unpredictable climate challenges and direct and indirect effects of diseases, uncertainty of agri-food production, processing, marketing, transportation, income, and so on. Despite COVID-19 affecting every country, including the developed ones, South Asian countries are facing more challenging situations due to our large populations, high poverty, poor social protection system, and limited access to protective and preventive measures to contain COVID-19. South Asia is hard hit by the dual challenges of climate change and COVID-19 pandemic. It's therefore critical for us to look at the two global crises happening together and to better understand the interconnected and compounding challenges faced in the food system in South Asia. Nature and process of COVID-19 and climate change impact on agriculture and food system vary. While the impact of COVID-19 is sudden, spreads fast, and causes immediate high risk, the impact of climate change builds slowly over a certain period of time with long-term effect. The impact of climate change on agriculture are manifested through extreme weather events that we have been observing. Global warming is on rise, which is likely to increase the rise of water level and devastation of lands and agriculture, and aggravates the situation of human and animal habitats and health. Climate change effects that we are experiencing today are due to the greenhouse gas emissions. And per capita gas emissions is actually occurring in rich countries and developed countries like USA, UK, and other European countries and Japan. But we are paying the price. Without glacial and slow melting, flash floods, and level of cyclones, frequency of cyclones, untimely rainfall, heat stress, desertification, and so on. These threaten the very foundation of our agri-food system, food security, nutrition security, and human health and well-being. The effects of COVID-19 on agriculture and in South Asia have been substantially greater than in developed countries because of the limited mechanization and high labor intensity in agriculture in this region. About half of the workforce in South Asia is engaged in agriculture. COVID-19 pandemic disrupts the farmers and workforce in the food supply chain in various ways. Both the disease and the safety measures adopted to combat the COVID-19 pandemic continue to make the workforce incapacitated to execute their work. These, in fact, affect food supply from farm to fork and also from workers' income and economic viability of business in the food system. In addition, lockdown or curfew restricts the movement of workers, disrupting harvesting, processing, operations, and similarly, the trade restrictions limit the movement of goods, affecting food supply and consumers' demand from country to country. And price volatility is a challenge in South Asia. COVID-19 exacerbates this situation and disrupts our food security and the livelihoods of those depending on food supply chain. This severely affects smallholder farmers, especially women farmers, making them vulnerable to food insecurity and nutrition insecurity. Ultimately, the whole society, especially the poor, the vulnerable population, women, children, suffer most from nutrition insecurity. Climate change also displaces populations, and climate change refugees or environmental refugees, river erosions and loss of lands and incomes force the populations to migrate from leaving their rural homelands to the cities, and increasing urban population and intensifying urban poverty and malnutrition of all forms. The global capital market and modernization are displacing our indigenous and traditional farming practices and traditional crops and food and eliminating our traditional food behavior and practices. This deprives our existing good knowledge and practices and culture which are supportive of ecological balance. In this critical juncture, we need to emphasize science policy interfacing. And that means that we should, all the scientists and the policymakers, we should be working together to develop an action-oriented, unified regional policy, because all in South Asia, we are all interconnected. So we need to have a regional policy. And this policy needs to be founded on evidence-based decisions with the support of a functional regional network in South Asia. To address nutritional status of women and children, policy and institutional innovations are critical to utilize science and technology in addressing food system and climate change. Incorporating traditional and indigenous knowledge of food systems and improving food behavior and practices. The urgency is now. South Asian countries must work together to improve nutrition security, health security, and productivity in the region by protecting the planetary health and creating a better future for our future generation. We cannot leave a fragile and frail world for our children. The government, the private sectors, the civil society, farmers, community, people, women, youth, intergovernmental bodies must work together with interdisciplinary and transdisciplinary scientists coming from nutrition, from agriculture, from health, from education, from different sectors for building a better world and better future. It means we must have political commitment, financing, practical innovations, and good governance to save life and save planet. Thank you so much for giving me opportunity to speak.